Hello everyone, and welcome to the McMaster University Demystifying Medicine YouTube channel. Today, we will delve into electroconvulsive therapy, or ECT, and its common myths and misconceptions. More specifically, in today's video, we will first provide a background on ECT. Then, we will debunk 5 myths relating to ECT. And finally, we'll conclude with a summary of today's video. So let's start with some background information. You may be wondering, what is ECT? ECT, which stands for electroconvulsive therapy, is a medical treatment for those with severe mental health conditions. It is a 5-minute therapeutic procedure where doctors medically induce a very controlled seizure by passing electrical currents through the patient's brain. It takes a team of trained medical professionals, including a psychiatrist, anesthesiologist, and nurse or physician assistant. Though researchers still do not fully understand how ECT works to treat mental health conditions, the procedure seems to cause brain chemistry changes that result in the reversal of symptoms that are associated with certain mental health conditions. Many researchers believe that the seizure occurring during ECT affects the circuits or neurotransmitters in the brain. Just to give some insight, circuits are essentially the roads in your brain that allow information to pass through, while neurotransmitters are the messages sent in the brain. ECT treatments occur roughly 2 to 3 times a week, and patients often undergo a total of 6 to 19 treatments, depending on the severity of symptoms and the responses to treatment. To start off the treatment, the anesthesiologist will administer general anesthesia, the medicine that puts people to sleep, and a muscle relaxant to the patient through a needle that is inserted in their vein. They will also administer oxygen through a mask. The patient's heart rate, oxygen level, and blood pressure is monitored throughout the duration of the treatment. Once the patient is ready, electrodes, or small metal discs, are applied to the patient's scalp. Then, doctors stimulate the patient's brain using brief and controlled electrical currents or pulses that pass through these electrodes. As a result, the patient will experience a controlled seizure that can last anywhere from 30 to 90 seconds. The patient will only be asleep for about 5 to 10 minutes. There is a lot of stigma surrounding ECT, but much of this is based on early treatments. In early ECT procedures, high electricity doses were administered without providing patients with anesthesia, which led to complications such as fractured bones, memory loss, and other negative side effects. While there are still risks of confusion, memory loss, nausea, headaches, jaw pain, and muscle aches, many of these symptoms can be managed with medication. Plus, many patients report being able to return to normal activities soon after the procedure. In fact, ECT has been approved by the Food and Drug Administration, also known as the FDA. In 2015, the FDA made even stricter criteria for ECT treatments to ensure both the safety of patients and their accessibility to ECT treatments. Now that we've discussed the background of electroconvulsive therapy, let's debunk some myths about ECT. Myth number 1, ECT causes brain damage. It is a common misconception that electroconvulsive therapy causes brain damage. Over the past few decades, there have been major advancements in neuroimaging techniques, which have allowed researchers to more accurately study the effects of ECT on the brain. There is significant research to support that ECT does impact the structure and function of the brain, but without causing any form of brain damage. There is no structural damage in the brain, only evidence that ECT causes growth in the hippocampus and neuromodulatory effects in the hippocampus, amygdala, and some parts of the limbic system. Though it can be scary to hear about brain-altering impacts, one should note that many antidepressant medications, which have significantly less stigma in society, also cause this brain growth. That said, there is a wide array of evidence that disproves the myth that ECT causes brain damage. Myth number 2, ECT is only for depression. There is extensive research regarding ECT as a treatment method for major depression. Roughly 80% of severely depressed patients treated with ECT have substantial improvements following treatment. However, ECT is not only used for depressive disorders. ECT is also used for other severe mental illnesses such as schizophrenia and bipolar disorder, as well as mental conditions such as mania, psychosis, and catatonia. Mania involves experiencing very polarized emotions, overactivity, and agitation. Psychosis involves losing touch with reality, such as hearing non-existent voices. Finally, catatonia involves a lack of movement or communication, as well as agitation, confusion, and restlessness. ECT has been found to be a very effective treatment for all of these disorders and conditions. Myth number 3. ECT is a cure for depression. While ECT can be very effective at treating illnesses such as major depression, it is by no means a cure. While some patients are given a short series of ECT treatments and consequently their health stabilizes for decades, other more serious patients may require ECT on a regular basis to stay healthy and free of severe symptoms such as suicidal ideation. Additionally, many patients who receive ECT are also given other treatments to manage their illness. For example, a patient with severe depression may receive a short series of ECT treatments and in conjunction take prescribed medication to treat depression. In a case like this, even when ECT is extremely helpful at stabilizing the patient's mental health, it is also crucial that they continue to take their prescribed medication as instructed by their doctors in order to remain healthy. Myth number 4. ECT causes permanent memory loss. In reality, one risk of ECT is temporary memory loss. Some people treated with ECT have difficulties remembering events that occurred immediately before or in the weeks and months before their ECT treatments. Rarely, however, do they have trouble remembering events from years prior to their treatments. Some people may also have trouble recalling events occurring throughout the weeks that they receive ECT. The critical thing to remember is that for most, these memory issues improve within a couple months after their treatment ends. In fact, the majority of the memories patients lose during ECT come back completely within 2 to 4 weeks after receiving treatments. In other words, while there are risks of memory loss when receiving ECT, usually this memory loss is not permanent. Additionally, the memories that patients forget are more recent memories, like what movie you saw a couple weeks ago, rather than what your name is or who your best friends are. Myth number 5. ECT is cruel and is used for punishment. Contrary to what the Hollywood films portray about ECT, ECT is not used as a form of punishment. Patients are made comfortable with anesthesia and muscle relaxants so they do not feel any unwanted pains. Additionally, doctors discuss the benefits and risks of ECT prior to treating patients. Patients are only treated with ECT once they have been properly educated on the procedure and signed a consent form. So, to conclude, in this video, we learned that electroconvulsive therapy is a short medical procedure that involves using a controlled therapeutic current to induce a seizure in a patient's brain. It is administered under general anesthesia by a group of medical professionals to treat various mental health conditions. Despite common misconceptions of this treatment, likely as a result of earlier forms of the treatment that were much less safe and regulated, ECT is safe and FDA approved. In this video, we also debunked the myths that ECT causes brain damage, only treats depression, is a cure for depression, causes permanent memory loss, and is a form of punishment. Rather, ECT fosters brain growth, effectively treats an array of mental disorders and conditions, alleviates patients' symptoms but is not a cure, causes temporary memory loss, and finally, requires a patient's comfort and informed consent. In conclusion, while there are many misconceptions surrounding ECT, a wide body of research supports its value for treating mental health conditions.